Hey guys, Tony Maritato here, joined by Steven Coen. So I want to give a little context even before I bring you into this conversation. First, I was sitting there watching Dave Kittle and you talk about RTM. And truthfully, I am completely green. I know nothing about RTM. I know it came on the scene probably a couple years ago. I had the same gut response that you're probably used to hearing. It's like, "Ah, it's another thing. It's not going to make enough money. I don't have time and I'm not going to burden my clinicians with one more thing for them to manage." So I gave it a couple years. Now I'm kind of circling back and listening to your episode with Dave. And for those of you who haven't watched that episode, I'll link it down below. Go check it out. It's a great precursor to today's conversation. You guys completely changed my outlook on it. And specifically, SaRAHealth, which is your company, um, I had no idea this kind of stuff was possible. So first, in like 30 seconds, give the audience a sense for, who you are, what SaRAHealth is, and what brought you into this space.
Absolutely. So first of all, thank you for having me. I'm blessed to be on here today. And so, the intro to me and intro to Sarah are pretty intertwined. I am a frustrated patient. So I've torn my labrum, had that surgically repaired, ACL meniscus, had that surgically repaired. I've been in PT practices a lot, and I've always been really frustrated by the lack of continuity in between visits. And so Sarah Health is really just my attempt to make a dent in the universe, right? To quote Steve Jobs, and built the team with our CTO, who's got a master's in computer science, has built applications at Goldman Sachs, Box, beyond, and our chief clinical officer, Paul, who has spent a little over a decade at the Mayo Clinic in Rochester, Minnesota. And so you had business, tech, and clinical in the magical triangle, as we think about it. And we've been doing RTM before it was cool, right? And so when we started in 2018, I think this will lead into the codes as well, is we threatened, in at least most practice owners' mind, we threatened the only way they made money, which was in-person visits, right? And so we were not in the fee-for-service world for the first 4 years of our business. We were helping practices that had population management contracts be able to deliver more care and more compliance in between visits. Everyone won. And when these codes came out, we kind of looked at ourselves like, this is what we've been doing. Like, so glad y'all caught on. Let's go. And so that's our background, which I think has given us a much different approach to how we attack it and how we think about it. Is because again we were doing it before the codes came out.
There are so many tech companies that are way ahead of their time. The problem is they can't sustain until everything else catches up. So I'm glad you guys are still around. Now, something that you said in Dave's interview that immediately caught my attention. You said your platform basically reduces friction. It's a text-based platform, which I'm super excited about. I don't know if you know this. The way Dave and I originally met, gosh, probably 10 years ago or more, was with Vinicial and
Yep.
texting. And I've wanted to incorporate, I'm going to ask you questions, but I've been wanting to incorporate text messaging and texting into my practice. That's really a big part of the reason why your content caught my eye. So tell me a little bit about the platform and the whole idea behind the text-based integration and framework.
Absolutely, right. And so again, when you look at these codes, there's a couple things that I want to immediately point out. One, it's probably work you're already doing, right? You're already delivering care between visits, whether that be responding to patient messages via email, text message, EMR notifications, what have you, right? And so I think a lot of people look at it, and you mentioned it in the intro, right? I don't want to burden my therapists. Like, well, if they're already doing a chunk of the work today, why not get paid for it too? Right. And so that's one piece. And then another is that what are these codes meant for? It's meant to incentivize practices to invest in technology to deliver more care between visits, right? Like that's really it when you look at how it is. So then you start to think, okay, well, how can I make this as easy to make my funnel as big as possible, right? And that's reducing friction to get the patient to even start. So that's why we started with the text messages years ago. Is we figured out, oh, okay, you can get really valuable clinical data from a text message response. Now you have to write the questions really well, which we've spent years and I think over 1 million messages now analyzing and figuring that out. But that's what we found because we had an app, we had a web app, we were doing the home exercises, we were doing all that. And as we got into more of these different populations and very different specifics, we're like, man, like we hear so much feedback from a PT saying, I really just want to know how their pain is trending. Or when you get outside of just the pure orthopedic, total joints, your vertigo patients, I want to know how dizzy, like how many dizzy spells they had. And so what we found was a nice way to marry a low friction way for patients to communicate and deliver data in a way that was still clinically valuable. And as we've done our own outcomes research, we found that patients on SaRAH achieve about a 20 to 25% better functional outcome, according to Photo, and they do it in 2.3 fewer visits, which shouldn't scare practice owners, right? That should not scare you at all because it is so funny. Like, ooh, that scares me. Like, but you have a 2 week wait list and you can't hire anybody. Like, make it make sense to me. And you can't, right? It's like, oh, actually, if I could have a higher adherence to the call it like 6 to 10 visit plan of care where those get finished out more often, and I'm reducing my longer term patients that maybe are just coming for that social interaction, right? But are not really helping drive your financial performance for your clinic. Like that's the evolution that practice owners are having to take. So I took that a little bit, diverse a little bit, but I hope that that's okay.
Yeah, no, that's perfect. When I was watching the interview, you said like 5 times, "No app download," which I love. I avoided telehealth for a long time because I didn't want my clients having to download an app. You also said something that I'm a huge fan of. You said, it'll reduce the number of visits per episode of care, which yes, to some people that sounds like, well, I'm reducing revenue, but in reality, to me, I can handle this a couple of different ways. I eliminate a wait list, that's gone. I can look at also shortening each individual session rather than necessarily shortening how many sessions are in the episode. But it gives me the opportunity to then progress that person to a self pay continuity program, which is huge. Like everybody is trying to move off of insurance into self pay. And this is really the way to do that. Now, I've got some really specific questions, level 2 questions that I want to ask you about. But before I do, give me an idea, the framework, like what exactly happens. I'm a physical therapist. I evaluate a patient, I initiate the start of care. And then how does this all work?
Absolutely. So enrolling at eval is huge, and whether you're using us or not like I'm going to give tips for everyone to succeed because I believe a rising tide will raise all boats. A couple things to do: see ways that you can involve your administrative or non-clinical staff, and so we've given the non-clinical staff of our customers a way to enroll patients, to be able to handle some of the admin burden, right? Because when you're talking about putting additional burden on your clinicians, what we find is that admin burden putting on clinicians, that's a no-no, right? Don't go there. Clinical burden, like, okay, like if I can get clinical value out of it, like as long as that ratio is somewhat similar, like we're good, right? And so from there, a PT that told me how she describes it to her patients, and I think it's perfect, right? Is when in the eval, hey, this is a part of the insert practice name experience, right? We give you access to us in a frictionless way in between visits. So that way I can help you get to the goal that you're pursuing quicker and full stop. And you're talking about more efficient visits, right? We see that all the time of no longer asking, hey, Tony, how's it been going since we last saw each other, right? That is a worthless question that can go into any different, areas that are just not helpful versus, hey, Tony, I see that your pain is going down. You've been really adherent to your program. And actually, you're saying it's too short for you. So I want to actually, that's where we want to start our appointment, right? That's so much more valuable. And I will say, like, kind of talking out of the both sides of my mouth a little bit, you're not really being paid for a more efficient visit in the fee for service world today. but it's not hard to think about how you might be able to use that extra time gained, right? To be able to look at other opportunities. And so as patients are responding, we're tracking all that on behalf of the clinician. When patients are billable, we have a little tab, their billing tab, that say, hey, copy paste from here into typically the objective portion of the SOAP note, and tell us when you build it, and then we're tracking all that, so we never surface a code to you as a clinician that will get denied for any sort of administrative reasons. And so again, like billing, administrative burden, take it all off. And if there are responses that are outside of what we consider standard, we alert the provider, hey, review this, right? We don't take any sort of clinical point of view on those responses, and we highlight ways to respond to the patient. And I tell you what, when a patient responds with a non-standard response and then that clinician sees it and sends their own custom, or as Rachel would say, like robot Rachel sends the first message and then anything after that is Rachel, oh my gosh, like Katie bar the door, engagement is going to go through the roof, which means you're going to be able to hit that 98977 code way more often, which in my opinion is the golden goose. Like that's it, because there's no time required for it. All it requires is patient engagement, and it's a high margin code where you're really getting paid for the relationship you're creating and then in the clinic and then sustaining in between visits.
I'm going to put two questions together. I'm going to forget the second question. Question number one is, what does the administrative burden look like? Is it something where they have to, like, obviously, I would imagine they put the patient into SaRAHealth's system. They have to put some demographic information in there. And then the second part is, I want to know really specifically, are the texts coming from the therapist in the sense that the therapist is following your protocol for what questions to ask to get the best information? But I would also imagine those questions could be customized by the therapist and kind of add the therapist's unique flavor to it.
So I can answer. I think I can answer both.
Okay.
So as far as the information we need to start, patient first name, last name, cell phone number, estimated length of care, as well as what they're being treated for and preferred language.
Okay.
So we can send this out in Spanish, Chinese, Russian. We're adding new languages for each of them, and that patient type is really key. And so a patient that is a total knee patient will get something different than a vertigo, than vestibular, than a falls maintenance, than a general orthopedic, than a lower back pain. Like we have a whole set of these patient types. And that's where the clinician says, okay, this is this patient type. And from there, we know the questions that are going to go out for the entire length of care. So your therapists don't have to think about what's going to go out each day. Where they put their clinical mind to is how to interpret the responses, right? Because as you and I know, and I think many others, it's way easier to react to something than it is to create. And so that's what we've done, is just make it reaction based and not having the burden on the clinician to create on a daily, hourly, monthly, week. Like it's not there. So yeah.
So let me ask you, what if the therapist wants that burden? What if the therapist says, I want to have some sort of influence on this, or it's a question that you guys have developed, the therapist gets the response, and now you've said this, and this is going to take me into my next question. The therapist wants to engage and follow up on that question right now. Is that a functionality, or do they
Yep.
just call them on the phone? How does that work?
Oh, well, if it was a response that warranted a call, then you would also log that time within SaRA, because that goes towards another set of the codes. We call them the support codes, 98980, 98981, which are those 20-minute timed codes. So that's, again, it's back to the clinician. Like, okay, get response. Maybe it's just I like to use this one. So patient was asked, how's your pain today on a scale of 0 to 10? And patient said 2 because Lucy, you're a genius. So this is an actual response that Lucy, one of our customers' PTs, got. And for that, she smiled and went on her day. Like that was it, right? But it could be, you can imagine if she had time, like, oh, thanks, that's so kind. Can't wait to see you on Thursday. Boom. And she can either send that immediately, or schedule it to send at a later time. And
So
so where we see,
the
yeah,
therapist can do that response.
yep.
Okay.
And the scheduling piece gets really fun because now, and my therapist likes to use this because I'm on planes a lot. So go in, okay, perfect. Instead of being like, hey, tell me how your flight goes in a week, she schedules, hey, how was your flight, and schedules that to send 4 hours after I'm supposed to land, right?
Right.
Like that's so you could do both.
Okay. Within the response that could be sent, are you able to send hyperlinks?
Yes.
Okay. So here's my vision. And this was in the email I sent you before we hit record, but I want to kind of flesh this out a little bit for the viewers. So I could see a situation where I'm using SaRAHealth. I've got this texting back and forth. You guys have your protocols that you put together. I saw it in the last interview. Great protocols. And then at some point, maybe I'm sitting here and I'm like, you know what? I've got a little bit of extra time. I've got an extra 15 minutes. I get a response back. Then I say, hey, let's jump on a video call right now. And I send the link to my HIPAA compliant telehealth platform that I'm using.
Yep.
And at least through Medicare through the end of 2024, it's not on the slate for extension, but at least for right now, I can bill. Maybe I'm going to do something looking at their, transfers from sit to stand.
Yep.
I'm going to bill 97530. It's a single unit. It's HIPAA compliant. It's done on my telehealth platform. And now I just got a $40 reimbursement for that 10 minutes of time that would have gone unutilized and is helping the patient, but that doesn't detract from the RTM. The RTM opens that door for me to have that communication.
100%. So we see on the hyperlink side, I don't know if we've seen much of that to date. In full honesty, what we do see is sending videos of updated exercise plans. Right, a lot of people use other HEP because we don't offer HEP, which nope, not our thing. You can use whatever you want to, whether that's VHI copies or or MedBridge or PT Wired or Hep2Go, like whatever. So we see those links go out. Some groups use it for NPS scores. Like it's really like it's what you want to make of it. So yeah, we see that quite often on links and such going out to patients.
Now, another add on to this would be affiliate links and digital product links. So, this is where we go back to, and this was something that I had worked on with Dave a decade ago. I'm like, look, if I'm going to communicate with my patient who just had a rotator cuff repair and we're seeing how things are doing, I personally hate selling in the clinic, but
Yep.
I have no problem sending an affiliate link to a shoulder pulley system that they could buy for 20 bucks online. And so if we're going to have that communication, that's a super easy one. Another one that we used to do quite a bit was sending links to digital products. So I've got a, 12 session mobility program that's not covered by insurance. It's something independent. I'm like, hey, if you're not going to do this, why don't you give this one a shot?
Yep.
So all of these opportunities, it's just opening these new revenue streams. Let me go a totally different direction now. You and Dave talked about having one person on the team who handles all the RTM for all the patients versus each therapist handling their own. I'm going to take that a step further because I know I've heard of this being done. Who or what's the situation with, let's say I'm looking for something different to do. I don't want to be in the clinic anymore. I'm at home. I've got tons of clinical knowledge. Can I start a business or a contract kind of company where I will go in and I will handle all the RTM for 10 different private practices? They hire me. It's a contract. They put me on their credentialing. I've got my Medicare PTAN reassigned to them. I am part of the team, but I am not going into their physical location. I'm doing everything remote. Is that a possibility?
Definitely a possibility. I don't know if we've seen that very often. Where we have seen we call it the headquarters PT.
Yeah.
So where we've seen that is especially someone's going to relocate, right? I think of a practice we're working with in North Carolina. They were about to lose someone they really really liked because she was moving with her husband for his job and didn't want that to happen. And they're like, wait, we're using Sarah. Could she just run everything and like be the point person? Yes, absolutely. Right. Like, of course, being compliant with state licensure and all that. But yes, we see that. We've seen multiple groups where a PT will go out on paternity or maternity leave and like, I just don't think I can be in the clinic 5 days a week because I want to dedicate time to my family in this, especially like brand new kiddo, right? And so like, oh well, could you run this for 2 or 3 hours a day and maybe come in a day a week or something like that. So we've seen that, and that gets me really excited. Like I love what some of these companies like Luna and others are doing by giving flexibility to PTs, and that's what we want to see more of. Is let's stop losing extremely valuable, extremely good clinicians to a system that requires 5 days a week being in clinic, right? Let's stop losing them, and this does provide that additional opportunity to be able to keep that talent in house without losing them, right? And you don't have to look very far. In fact, you look at remote patient monitoring, right? So that's the physiological monitoring, blood pressure cuffs, continuous glucose monitors, and there's these companies that are like especially health systems that will outsource all of that tracking and management and everything to a called a nurse call center, right? There's a little bit different licensure because MDs are prescribing it, but bear with me, right? So they're doing exactly what you're talking about, which is, hey, let's get this headquarters group, and that's just our verbiage. This headquarters group to do the management of it, and when needed, interact with the treating therapist to be able to make sure that they get the data they need and that they can get the valuable input. Like, oh, like, this, Jim has this thing with his knee. Like, don't say that. And so the short answer to your question is yes. And I hope those examples help really make it crystal clear on how we've seen it in practice.
Yeah. Yeah. I see so many opportunities for layering on top of this, that I don't necessarily see a lot of people exploring. And I get it. Therapists are busy, practice owners are busy, margins are thin. It's like you're on that hamster wheel and it's going so fast. You can't take a breath to realize there are other ways that we can use the technology we have. Let me ask you some grassroots questions. So if somebody comes on with SaRAHealth, is it my understanding is the pricing model, and I don't care what the price is, just generally the pricing model is it's per patient. Is that correct?
Not quite. So I'll actually
Okay.
walk through our entire business model.
Yeah.
So from the day, first of all, we do a owner's onboarding or practice leader onboarding. So we get the commercials, like how they want to talk about enrollment, all that stuff lined out before you get a single staff PT on a call, right? You got to get that stuff done beforehand, have an aligned view of it because you're going to get the question of are we enrolling commercial insurance? And I can't answer that. Only you can, right? And so we help practice owners and leaders like, okay, here's probably the questions you're going to get on Monday when we enroll when your staff comes on. Have the answers to be able to talk through them, talk through incentive structures, all that stuff. Then we move to staff onboarding. For us, that's an hour, typically done via Zoom, sometimes in person. And that's all we need to get everyone from your front desk to your staff PTs and everyone in between rocking and rolling. And then for the first 90 days, we basically don't charge. We don't send you an invoice. So that way you can see what your actual reimbursement is and you're not guessing because it still is a submit and see, right? We have some pretty good data in a bunch of different states around how national and state payers are paying, but still, hey, figure this out. And the way we charge is the way you charge, which is we only charge for the CPT codes we deliver to you. So, Tony, if you enrolled 100 patients and none of them hit a billable threshold, you would owe us nothing. And that highly incentivizes us to get way better at what we do. Now, I don't think that'll happen based on what we've seen in prior work, but that's how we align ourselves to the success of the practice. Now, we can't attach ourselves to collections because that would violate the anti-kickback statute. I believe some think that you can because PTs fit in a bit of a different realm than the MDs do, but we've been called the most conservative RTM company for the way that we think about thresholds and collections, all that. And I'm happy to lose somebody if if that's it. We're not going to change our ways because I know when there's an audit that the things that they're going to ask for are, can you show all these interactions? Yep, here you go. Can you show you're using the software as a medical device? Yes, here's Sarah's letter from the FDA stating that we are a software as a medical device under enforcement discretion. And those are the two big pieces, and we're going to be able to give that, and like bulletproof. Here you go.
Do you have any like minimum thresholds? Is there any provider that's too small?
Nope, we do not.
Okay. And then have you had any providers that have been audited specifically for the RTM codes?
Not not to my knowledge. Now, it very well could have been that someone has been, and because we have all the data right there for them, they didn't need to ask us any questions. But to my knowledge, we have not been audited, or the claims that we help facilitate have not been audited. But again, it's very possible across the entire customer set that we have today that because we give all those for easy copy paste, that it just wasn't a question by Medicare.
And talking about Medicare specifically, do you have any information on, do the RTM codes apply toward the financial threshold for PT and SLP?
Yes, it does apply towards the financial cap, but not towards the visit count. So a key point is this is considered sometimes therapy. So it's not a typical treatment. You should never see a copay, and you should never see it count towards the visit count. If you do, that's a red flag that that payer does not understand these codes, which we're still seeing, to be quite honest. It depends on the state, in particular, not only from a payer, like a regional payer, but also from even the like Uniteds of the world, that we're seeing that different states and regions just have different levels of, we'll call it maturity, and being able to handle these codes. So as part of our service, we help fight denials, and so that way we understand. Okay, hey, look, actually, great example. We have multiple practices in Georgia, and one of them got paid by Humana, and one got denied. And we're like, doesn't make any sense. And what we found was, at least in Georgia, that if you bill Humana for the RTM codes and you include that 9.7 modifier, it's almost assuredly going to get denied, because if I had to guess, now complete conjecture here, I bet there is something as simple as a V lookup that they're running. Like, okay, is code in PTOT SLP specific code set? No, it's not. It's at a higher level, but because you put the 9.7 modifier in, deny, resubmit without the modifier, boom, get paid, and everyone's happy.
Right, right. Yeah, the modifiers are just a disaster across state lines, across multiple payers. Man, so I want to be respectful of your time. We're pretty much out of time, but it's one of those things where and I'm sure obviously you created SaRAHealth along with your team. I like to tinker. I like to figure stuff out. I like to take something and build on it. I think something like this, I see it really rolling out in two ways. And I'm going to keep developing these ideas, and you and I will keep talking. But on the one hand, I could see the practice owner from the single mobile provider who's just getting rolling, and they don't have enough patients and they need more revenue and they're trying to figure this out, to the busy clinic, multiple locations, a full team of clinicians and everything. I see those people doing it, but then I also see a big opportunity for somebody who wants to build a business on your business. Somebody who wants to say, look, I'm the SaRAHealth RTM provider of choice. I'm the one. I'm going to get you new referrals. I'm going to like, I don't even see, and this drives me crazy. So I was like, well, what does a report look like? I know you said it generates a report for you, copy paste. I know you said there's a Chrome browser extension. Like, I love all that stuff. But I'm like, I'm going to Google this because I want to see what something like this looks like. It's not out there. Like, the articles are terrible that are out there. Somebody needs to create this kind of content, videos, demos, like implementation. I think somebody or multiple people could build a business on your business and really just bring it out to more clinicians, so there's so much opportunity in this. What is the best way for people watching this who are just as excited as me to get a hold of you and kind of get more information?
Absolutely. So my email is Steven, Steven, at SaRAHealth.com. So please feel free to reach out directly. Our website is SaRAHealth, SaRAHealth.com. And people ask sometimes like, what the little a, like, is that a thing? It is. And to, I guess, further the point of the smaller groups, we see ourselves as existing to create stronger and more resilient patients and practices. So hence the little a, right? SaRA. And so, yes, please reach out to me. And happy to have conversations with folks who are interested in building a business on ours. I think, to your point, there's a great opportunity there. Folks that are interested in learning more about us for their practices, or other potential partners that, like, hey, we have we have a custom orthotics, and we know that if a PT helps deliver that at the right point at the right time, that there's a better take rate, right? Like, could we work with SaRAH to do that? I mean, yes, right. With our ability to schedule messages and events, like, that's all there. So would welcome those conversations, and I'm much appreciative of you allowing me to be able to have this time on your platform to be able to talk about something that I hope, obviously, am passionate and very energetic about.
Absolutely. Don't go anywhere. So guys, I'll put all of his information down in the description of the video and I'll get that out to you. This was a great interview. Steven, stay where you are, but thanks for coming on.
Thank you.